The goal of this video is to highlight how we can use BFR on our upper body to help for fractures. In this case, my right hand, which has the band on the wrist, that's the broken hand. It's immobilized in a cast, and my left hand is my good hand. There's two main goals that we want to achieve in this initial phase. Is one, we want to decrease or attenuate muscle loss. And the second thing is we want to somehow promote markers of bone reformation, which is really difficult to do. And BFR has been shown to be able to do both things. What we're going to do for the fractured arm is we're going to do passive BFR, because if we start doing activity with that arm as limited as we can, we're going to have intramuscular and intracellular swelling. Well, what's going to happen is that the pressure of the forearm is going to increase on the cast and get uncomfortable. But we'll cover that in a moment. What we're going to do is going to use the extender piece. You click on the silver, you put it on like so. You may need help, put it on. But the good thing is you'll be using your good left hand. And the advantage of having this piece is we now have this longer piece. And depending on how much use you have with your hands, you may still need some assistance. But anyway, you get someone to help attach it like so. Then what we would do is, for the first time you use it, if we measured you to be 150 millimeters of mercury, we do a small inflation cycle where we would inflate it in 10 millimeter increments of pressure. We'd start at 120 and then we'd hold that for 40 seconds. Now, because it's quite a long piece of tubing, is we'll get a small decrement in pressure. So you just need to readjust that. And ideally, if we want to hold that pressure when we use it, we would then take the valve off. For the sake of this, because we're only inflating it for short periods of time, so 40 seconds, and then we decrease the pressure, it will be the red button on the pump, 20 seconds off. We'd reinflate to 130. Because we've got the tubing all interconnected to the pump, it's going to slowly leak pressure. If we would take it off from the valve, it would hold the pressure. That's just how the pumps and the valves are made. So we just keep rechecking it at 130. This just saves you taking the valve on and off all the time. We just keep readjusting it, decrease the pressure. And on our third time, we would inflate it to the pressure that we're going to use. And because it is a longer piece of tubing, if you've calculated it to be 140 millimeters of mercury, for example, I would suggest to take it up to 10 millimeters more because of the in the tubing, or even 15. What we're going to do here is that you're going to just passively sit there for 5 minutes on, 2 to 3 minutes off. I would suggest 2 minutes off. And we're going to do 4 cycles through, just sitting there, watching TV or doing anything. You can move it around a little bit, and that is okay. Now, things that we're going to be looking for is skin color. We want a nice dark reddish color. Purple or blue is too tight. If you had the palm exposed, you could probably use a finger. In this case here, press it and we use capillary refill time. It'll go white and then it'll go back to its nice dark red color again. We'd sit there for 5 minutes doing whatever you need to do. As I said, you could be moving around. You don't have to sit still. You decrease the pressure by putting your finger onto the end. Then this is where the trick comes in, is that you're probably going to need someone hanging around with you. Or what you can do, if you've got some good dexterity, you can use your fingers and then carefully put it on. And it should just click on nicely by itself if you've kept the valves in good condition. And reinflate 10 millimeters over because it's a long tube. Hold that there for another 5 minutes. Do whatever job you need to do. Again, we're trying to decrease or attenuate muscle loss in this side. Once we're finished, decrease it, unwrap it, and take it off. For the active part, this becomes a little bit harder. You're going to need someone to help you, because if you've got your arm in a cast, you're not actually going to be able to put this on yourself. So if you were lucky to have someone to put it on for you, you would get them while they're there to inflate it for you. Once again, going to that incremental light protocol, 120, 130, 140, 3 10-millimeter mercury increments. There's a whole selection of exercises that you can do. The goal that we want to do, though, is whatever we do on our left side, we want to do with our injured side as well. And that's called contralateral strength training. It's a really great lower body study which showed that if you did the same activity with the side that has the cuff on, you had improvements in the other side as well to a greater effect than if we didn't wear cuffs at all. I hope that made sense. We can't put the load through the fracture site, and that's okay, because really what we're trying to do here is all about signaling pathways, and we're going to create that on the left side exclusively. We're going to do a bicep curl, and we're going to keep it nice, controlled tempo. We're going to keep it at a controlled tempo. You count 2 to 3 seconds on the way up, 2 to 3 seconds on the way down, putting a band underneath the foot and mimicking that same movement with the non-BFR side. The other two movements is a side lateral raise, and we're trying to create a level of intensity on this left side, which creates all the different mechanisms and all the different signaling pathways, and then it becomes systemic, and that will actually help through the fracture site, well, hypothetically. And then our other one we're going to do is front raises. In terms of sets of reps, we're going to do bicep curls first, and we want to aim for as many reps as possible, that feeling of fullness. So around up to 20 repetitions, or some research will say 30 repetitions followed by 3 sets of 15. However, I'm really happy for you to go to that feeling of fullness. 30 to 60 seconds rest, just sitting there, and then go again. Go to the feeling of fullness, and hopefully if it's at a good pressure, you find in your second set you'll do less reps than your first set. 30 to 60 seconds rest, and then go again. 3 sets, first exercise done. Second exercise would be a side lateral raise. Do exactly the same thing. If you've never used BFR before, and if you've got some help around you, put your finger on the edge of the valve, decrease the pressure, give yourself a minute to 2 minutes just to rest. When we're ready to go again, you get your help. Just a little note that with the valve, press the silver button, it'll go click. Get them to put it on. If you don't have help, this part will be pretty much impossible to do in the short term. That's why you can do your passive stuff in the morning, and you could do this active stuff at another time when you've got some help. Grab the band underneath the foot, lateral raises, around 15 to 20 reps. If you get to 20 reps and it's feeling good, give it a short break, go again, especially for the first time and you've done it. You'll do that, set 2, set 3, decrease the pressure, small break. Reapply once again, having your friend to help you, and then a front raise. And there are 3 exercises that you include. Essentially what we're trying to do is we're just trying to create a level of intensity in one part of the body to activate the pathways that will hypothetically assist for the other part of the body. And doing them at the same time will have a small crossover effect. Once you finish that, take the cuff off and you're done. The session should be quite short in terms of what you're doing here. You don't really need a warm-up set before you get into it. And then you would do this daily, every single day. Note a couple of things such as RPE on a scale of 1 to 10, how hard it is. Also, any kind of pain. Do you experience any pain whilst moving? On a scale of 1 to 10, 1 being low, 10 being extreme. And then write any notes that you have as well. So with the combination of the RPE, noting RPE, pain, notes, also the pressure that you use, make sure you copy down the repetitions that you do for each set on each exercise. Look at that. For the next session, that wants to be your bare minimum. Can you achieve the same? Can you do an extra rep? Once you start getting around 20 repetitions of that feeling of fullness, is that you probably look at going to a slightly heavier band resistance to make it a little bit harder. Hope that's useful about how you could be using BFR on the upper body to assist in that early stage of a fracture for the arm.